Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and today we'll be discussing one of the quality choices that you have in the great state of Texas. And we are concentrating on the North Texas market to begin with, but this is going to give you an overview of one of the best branded organizations with whom we contract that deliver not only a strong product, but great product support. And we hope to help you along the way, regardless of the experience that you've had with this carrier. So that's a long way of saying today's presentation will give you a brand new look if you're brand new to the company, obviously, but a valued review for those of you that are familiar with Blue Cross Blue Shield in the state of Texas. The production itself is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel. Additionally, your marketer with Premier Marketing, your agent success manager, will have the access to this as well, should you need to do that through communication with them. So one of the things that you'll see in the software package is a section for both questions and chat. We ask that you put your questions in the questions box. We find that we address most of them through the course of a presentation, but we want to make certain that you have the information you expect to get full value of the investment of your time with us here today. And so that means we start with an overview of who's Premier Marketing. We're a national marketing organization that was founded in 1968. That's part of the Integrity Marketing Platform. We're licensed in all 50 states, acting as an insurance wholesaler through relationships with independent insurance agents such as yourself. And we do so at contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products, and that includes the base medical for the Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part B prescription drug plans. But we also offer a portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits that address specific additional needs that your prospects and clients may have. In the Medicare Advantage arena, we have the national carriers there for you, along with strong regionals that make a difference for you in your market. Hence today's presentation. We want to make certain that you have the awareness of the glory of the Blue Cross Blue Shield programs in the state of Texas. And that same philosophy carries over into the prescription drug plans, where these are generally part of the contract that you have with the MA program, but there are a couple of significant differences here. Where the Mutual of Omaha program is a separate contract from the rest of their portfolio, and Clever RX is actually a discount program and not a Part D prescription drug plan. Medicare Supplements, large selection of programs for you to use, but we want to make certain that we address the needs of the entire Medicare population, regardless of income or health factors, and this gives us the opportunity to do so. It also has a adjunct marketing campaign with it, where we have specific programs that help you be successful in this space as well. When we look at the ancillary products in each of those categories, we're looking at programs that are offered by the leaders in those areas, and it gives you the opportunity to have additional marketing opportunities outside of some of the regulated product we have in the Medicare space, but it also creates that additional revenue stream for you and your agency. The biggest thing, however, is the fact that it satisfies a specific need that you have within these areas to address the needs of your prospects and clients. So when we look at the Medicare market overall, we see a huge near exponential growth of folks turning 65, the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. But we're seeing a number of the folks that are eligible for Medicare that are deferring their Medicare access for one reason or another. For those of us at the tail end of the baby boomer generation, for us to get full Social Security, we got to go to 67. Might be a consideration. There are some folks that want to work past the age of 65, whatever it happens to be. But those numbers are more than made up for by the fact that there is a significant percentage of the Medicare population that has that coverage because of a medical disability. So when we look at these numbers overall, they're staggering. You have a huge opportunity in the Medicare market, and we want to help you take advantage of that because there are different choices that the Medicare population has. And that's one of the reasons why we're proud to partner with Blue Cross Blue Shield in Texas, because they give us the opportunity to cover folks whatever their base choice may be. I mean, you come on Medicare, you don't even have to take Part B if you don't want to. You can decline it. Some do in good stead. Some may make a mistake, but there are a number of folks that choose to go with just traditional Medicare and maybe pick up a Part D prescription drug plan to help with those costs. Some will help with the financial shortfall of original Medicare by going into the standardized, modernized Medigap policies, the Medicare supplements, and pick up that Part D for prescription drugs. And then there are others that will opt into the all-in-one, the Medicare Advantage, the Part C programs that bundle all the benefits together. In each of these categories, today we discuss opportunities to help people regardless of their choice. And that's important because when people are coming on Medicare now, in the past, it used to be a pretty even split between Medicare Advantage and Medicare Supplement plans. The last couple, 2-3 years has changed the circumstance a wee bit in the fact that we're seeing more action within the Medicare Advantage arena. Regardless, we need to make certain we have, as part of our portfolio, programs to address the needs, whatever the client feels is their best coverage. And we need to make it a understandable proposition, if we can put it that way. Every part of our world has its own language. I have a brother-in-law who's into computers. Man, I don't understand half of what he says. He has the same opinion of what we have in the Medicare world. Because if you look at the CMS website, acronym guide, 4,420 of them. That reminds us that we need to define what those acronyms are, perhaps minimize our use of them, but we want to make certain that we are able to properly communicate with our prospects and clients, because they are subject to different election periods. We run through these all the time, where these base coverages or opportunities to change coverages are set up on prescribed election periods. However, there are special election periods that enable folks to change coverage throughout the year. So many folks mistakenly think that, oh, gee, open enrollment's done, I can't change. If you look at these standardized special election periods or the special election periods, you'll find that the majority of people on Medicare will qualify for a special election period. The challenge is it in their best interest to do so? So that's a big thing for us to help folks decide, because they're not doing their annual reviews. This gives us that opportunity to visit with people throughout the year and positively affect their coverage choice. That is the base coverage to cover that financial shortfall with original Medicare. And we see that those reviews, well, they're not doing them regardless of what the base coverage is, or taking advantage of the tools that the government has out there for us to use to help understand the choices that we have. So we want to make certain that we can deliver information to folks in the manner in which they choose to receive it. For some folks, well, that might be the whole sit across the kitchen table, shake hands, kiss babies, and get elected in person. For some, it may be a virtual experience. Depth research tells us that a lot of folks coming into Medicare now are shopping before they visit with an agent. We want to make certain that we have the software packages or whatever it happens to be to help with a population that's increasingly digitally savvy. Because let's face it, we've all been charged with dealing with changes on how things are delivered. If you think about it, when the pandemic hit, for the first period of time, all the visits, or the majority of them with your doctor or your specialist, was handled virtually. And there are other aspects of our life that are affected as well. So some of the prelim work for hospital stays, for dental work, and even our lifestyle was affected by this, where faith-based celebrations of faith were handled virtually and still are in many circumstances. So we want to make certain that we have the technology available to deliver the information in a compliant fashion and make certain that folks can understand it. This will really help us with our time management and the delivery in a compliant manner. So what we have today is a visit with our friends from Blue Cross Blue Shield to speak to the attributes that you have with Blue Cross Blue Shield and how this can really help you in this market. So we've invited two of our friends with that organization to come on and visit with us about Blue Cross Blue Shield, specifically in the North Texas market. Before I turn things over, I want to make certain that there's a question that popped up that I can address it right away. John is asking, what is the percentage of agents that are 100% virtual with their Medicare biz, and what percentage are face-to-face or a combo of? John, what we're seeing in our experience with agents in the carriers that have the technology to support both avenues, and most do, and we have software that does as well, we see the majority of the folks that are a bit of a hybrid. You have the people that are much more comfortable with reaching out to people and visiting with them in person, which has its advantages when it comes to persistency and retention, but it also takes time. And then we see a smaller percentage, much smaller percentage, that's gone all virtual, but those folks do a lot of business. So it is a circumstance here where it depends on the carrier you visit. But our experience is the majority of agents are handling this on a virtual basis. So at this point in time, what I need to do is actually shut up and change the presenter. Tana, I'm sending this over to you. And there we go. So we need to introduce our friends from Blue Cross Blue Shield, Ms. Tana Kirsten and Mr. Alvin Sims, who are regional sales managers for this program in North Texas.
Yeah,
perfect. All right, Alvin, it's all you.
Yeah, hey, great. Thanks, John, for allowing Tana and I get a chance to come visit with you and your downline today. It's always a pleasure to get a chance to, engage our agents, whether it's virtually or in person. So today we're going to be talking about, obviously, what we've got going at Blue Cross Blue Shield for 2023. One of the things I'd like to start with here, as you see on the slide, is the greatest expansion year ever for Blue Cross Blue Shield. We've trying to get that. We've come out with some new plans, new counties. We're trying to get more innovative on our thinking on the plans that are available. And we're really trying to get some competitive Medicare Advantage plan offerings out there. When you look at our competitors, most have been in the market for a lot longer than us. Blue Cross Blue Shield began selling Medicare Advantage plans back in 2014. So, we're pretty much still in our infancy on the plan designs. But to be back, in the market for 9 years, this 2023, we're excited about some of the things we've developed over the last couple of years that we'll talk about before we end today's recording. So we're going to talk about those MA plans, some of the PDP options. Our network is the largest provider growth in our history. So, 2023 marked a number of records for Blue Cross Blue Shield. We've had the largest expansion in counties for 2023 that we ever have in the company's history. And that goes back to 1929 when Blue Cross Blue Shield was founded in the state of Texas. So we've had our largest provider growth in our history. Just recently over the last couple of months, just in the North Texas DFW market, we've added an additional, I think it's 400 plus primary care docs in the Baylor system. So, our Medicare Supplement offerings has been strong over the years. Some of us have met with some of those on the Med Sup side over the last few months, talking about what can we do that's a little bit different. The plans pretty much stay standard, right? But doesn't mean that we can't add some additional benefits in there. So, Blue Cross is really wanting to see where we can improve, not just in one market space, but across the board with our product offerings. And then, of course, we're always trying to improve those resources for our producers. Today we get some of our new MA offerings. We have some of the specialty plans I want to touch on just briefly. We have an MA only plan, which is a Part B premium buy down. Obviously, we're targeting the veterans who use the VA for their prescription drugs. That offers a Part B premium buy down for members in the range of $40 to $50 from their Social Security checks. We have an MAPD Part B premium buy down, have some HMO and PPO plans offered in various states, targeting those conscious Medicare eligibles that can offer anywhere on that Part B buy down from $40 to $100. And then we have some PPO plans in various states, as well as D-SNP plans that offers a flexible spend card. And what that means is, even if they have a standalone dental vision hearing plan with a different carrier, maybe it's that standalone plan that's been added that they own, if they have their plans through us, they get a card that has $1,000 on it that can only be spent on dental vision hearing, and it can go towards those additional benefits. So it's kind of like an added feature to whatever that client may have in place. And then members have the flexibility to use this allowance toward any of the benefits for that dental vision hearing up to that $1,000 annually. And then enhanced dental. This year, my partner Tana is going to cover some of the dental stuff here shortly, but our HMO and PPO plans are, needless to say, offered in various states. Some of those plans cover up to a $5,000 allowance toward dental benefits for basic and major restorative, including crowns and dentures. Some of those embedded supplement benefits that we offer too, some of our plans have already an embedded dental benefit summary. Okay, so the comprehensive embedded plans you have this year, last year it was 50% co-insurance. This year for 23, we jumped that up to 80% co-insurance. So we're trying to cover more of those allowances for you. Preventative Plus plans will maintain their co-insurance amounts, and we'll have the option to purchase a restorative buy-up package, which we'll kind of touch on going throughout this presentation for you today. And then our D-SNP plans will increase their dental allowance to $3,000 a year for 23. Our optional supplement benefit package, there'll be 4 packages, OSB packages, available in 23, with a maximum of 1 OSB package can be offered on a plan. So what that means to you guys as agents is the client has the capability of not only getting an embedded plan with their plan of choice, but they can also have an optional buy-up package, so to speak. So our basic silver package is new for 23. It covers major restorative comprehensive dental services. It'll be paired with the embedded Preventative Plus dental plan. So again, it's kind of like adding some additional coverages there for you. The 2022 OSB package will be renamed to the OSB Basic Gold. So we're taking that basic package from last year, 22, and we just retitled that as the Basic Gold for this year, 23. And then all of our OSB packages will offer a heavier plan pay for major restorative work, lowering the members' co-insurance, right? Kind of touched on that a little bit earlier. Last year was, this year it's currently last year it was 50%. We bumped that up to 80% this year. So the hearing exam will no longer require a $5 copay on the OSB Premier and Plus packages only. And then those prices for those OSB packages range anywhere from $30 to $60 a month as well. And with that, I'm going to turn it over to Miss Tana.
Awesome. Thank you, Alvin. So welcome, everybody. Thank you for joining Alvin and I and John to kind of learn more about Blue Cross and get familiar. Alvin covered some good points. He just talked a little bit about the dental benefits. This is kind of just an overview of where we were at in 2022 compared to where we're at in 2023. As you see, some of the things that weren't covered in 2022 are now covered in 2023. One of the questions we get asked quite often are our implants covered? They currently are not covered for 2023. Dentures are covered, as Alvin mentioned. And then a lot of the co-pays and co-insurance have changed to the better for 2023. That 50% moving now to 80% that we pay for some of those comprehensive services. We do use Dental Network of America, so it is a contracted network. It is a PPO option. So the thing to know about that is even if you enroll someone in one of our HMO products and they have embedded dental in that plan, it is a PPO. So they do have in and out of network, even if they're on the HMO plan. So great option for dental. I think, you know, there's no good insurance for dental insurance, but I think we gave it a good shot for 2023 to give our members some good coverage. Alvin already talked about the flexible spend card, that $1,000 additional on the D-SNP plan that we offer here in Texas. You know, these are just kind of a highlight of some of the things that we cover: dental, vision, hearing, spend card. We've got the telehealth by MD Live, silver sneakers are included, the 24/7 nurse line, you know, transportation on some of the plans. So there's a lot of things that we cover, you know, just as standard for our members. We always want to make sure we're keeping them happy and healthy. And then when we talk about our plan coverage, so if you're familiar with Blue Cross, you know that there are a ton of plans in Texas. I currently believe there's 37 plan offerings in Texas for 2023. So when Alvin and I are out meeting the agents, educating you on kind of what we offer in the North Texas area, since that's Alvin and my focus, you know, we don't cover every plan that's out there. We try to focus on the ones that are going to be probably the top selling or the most common, or the ones that gauge the most interest out of folks. So I'm going to kind of scroll down here and cover some. This first one I want to talk about is that Dental Premier PPO. This is a $0 PPO option. And if you look down here, there is embedded dental, vision, and hearing on this plan. And I'm sure it's hard to see it on your end, but the main thing about the Dental Premier plan is it includes $5,000 embedded dental. So great option if you have someone out there that specifically wants a Blue Cross Blue Shield plan, but dental is the driving force, then this would be a good option for them. On the middle column here, the Protect PPO, that is that MA only option that Alvin mentioned, $0. It does offer a $50 buyback on that plan, and there is no prescription drug coverage, so that is an MA only plan. On the far right over here, we offer the Value HMO plan. That is going to be our most robust HMO plan offering in the North Texas area. That's going to be competitive to your Humanas and United in our market up here. So on this one, it offers a $3,400 MOOP. And then the good thing about this is it offers a $0 drug deductible. Many of our other plan offerings have a $505 drug deductible on tiers through 5. There is no drug deductible on this Value HMO. It also adds an expanded preferred pharmacy network where a lot of the plans offer HEB and Walgreens as the preferred pharmacy. On this Value HMO, it offers Albertsons, Brookshire's, Kroger, Walmart, and Independence as well. It also offers a $2,000 annual max dental. It offers $75 over-the-counter benefit quarterly. It offers 12 one-way trips, transportation, and then your other things are also included, like that I mentioned, the silver sneakers, 24/7 nurse line, telehealth, rewards, all that is included in that plan also. On the next slide, we have Dental Value HMO that's equally the same, kind of on that Dental Premier. It is a $0 HMO, so your co-pays are going to be more cost-effective since it is an HMO plan. This one as well offers that $5,000 annual max on dental. Right next door to it is the Saver HMO. This is a $0 HMO option with a buyback. So we know with the call center and a lot of these TV and television and these things, it's all about the buyback now on what they can get for their Part B or money back on their Social Security. That we do have a couple options here. The Saver HMO is a $0 HMO that does give them a $50 buyback, but also does include their drug coverage on that. So if you have someone that specifically wants blue and they know about the buyback, this may be an option for them. Over here in the purple, I'm just going to talk briefly. Alvin's going to cover a little bit more about this plan. Is our Flex PPO, the #1 selling plan in Texas. Very much a niche product. Right next to it is the Flex Access PPO. Same kind of coverage, same kind of benefits. The only difference between the two is the counties that they're in. So that is going to be the Flex plan. And then on the back here, you can see kind of the counties by color. You can see what plan number it is based on up above. And then you can see for each of these unique plan offerings, which counties those are available in. So Alvin, if you want to talk a little bit more about that Flex plan.
Yeah, thank you, Tana. Hey guys, we all know in this business, how strong med sups are, right? I've always been kind of a med sup fan because, if God forbid I get sick, but I don't have to choose from a network, so to speak. So a lot of people like that freedom, like the freedom to travel. So in 2022, we came out with this Flex plan, right? And there was a lot of concerns internally a little bit about, the premium was $215 a month, but it mimics that Plan F Med Sup. In that, you pay your premiums and there are no networks to be concerned about. There are no co-pays. There are no co-insurances. So it's been a really strong plan for us. When you stop and think about some of these clients that are aging up and each year having to battle that rate increase on their Medicare Supplement, when you get into your 70s or what, hey, if they're healthy, great. It's probably wise for them to reconsider what those rates are about every 3 or 4 years with their agent. And if they're healthy, maybe they can make a move and just pass that underwriting and move over to a little cheaper plan. But that's where we've gotten a ton of traction in this. Sorry, my cohorts, because I wasn't here yet, was a little worried, is that $215? How's the actuarials? Did they hit that right? Or are we next year is going to be $500 a month? So here's what I'll tell you, that $215 from last year has gone down to $213 a month. That's regardless of age and regardless of where you're at in the state that the plan's offered in, right? So we've seen a number of, Medicare Supplement clients that have, are paying $350, $400+ a month. That will continue to go up, as we all know. Bail off of that Medicare Supplement and come over to our Flex plan. So, here's the major difference in this, and it was how it was filed on the verbiage side with CMS. As we all know, that most providers in a Medicare Advantage network has to agree to the payments, terms, and conditions of that contract, whether it's us or a competitor. The verbiage in this Flex plan was filed with CMS says that if you take Medicare assignment, just like the slide's telling us here in the middle, and you're willing to bill Blue Cross Blue Shield of Texas. So stop and think about that for a second. If your client's on a Med Sup and they go see a provider that takes Medicare assignment, they're going to bill that Med Sup carrier, right? So we just try to make it simple in the filing. That's why it's so distinctly different as a Medicare Advantage plan, is because that's the requirements. If you take Medicare, original Medicare, and you're willing to bill Blue Cross Blue Shield of Texas, then those providers should take our plan. We've been trying to do a lot of provider Flex education outreach when we can. I will tell you, that this plan has moved into probably 99% of the counties we expanded into. I think we moved into an additional 35 counties for 2023 that we were not in last year. I know it's our goal to expand into additional counties next year. And just like our individual side of the house, I believe it's our goal at Blue Cross at some point to be in all 254 counties in the state of Texas with a Medicare offering, Medicare Advantage offering. My curiosity is, some of these Texas rural areas have a lot more farmland and animals as opposed to providers. So, that's going to probably take some heavy effort and lifting on our provider side of the house. But, what I have personally dealt with 3 or 4 clients that, when they tried to set their appointment this year for our doc, the doc said, hey, we don't take Medicare Advantage. And every one of those we've gotten, worked out within 48 hours and reaching out that outreach to that provider's office and educating them that this is why it's different. And so with that, when a client enrolls into these flex options, they will also receive a letter that specifically addresses those providers that may balk at taking the plan. So it gives them a phone number, and it gives them, a location they can call and talk to Blue Cross Blue Shield should they have any questions on the billing or prior authorization requirements on those, which, because it's a PPO, and, unless it's something major, there shouldn't be too many prior authorizations involved. But it's just like any other plan in Medicare, right? So long as it's medically necessary, medical necessity. I will tell you that flex plan, my last comment on that is, especially since we transitioned to the PDP side of the house, is, we at Blue Cross, for whatever reason, we have 3 formularies. And, that flex plan is, I don't want to call it a skinny because there's still, I think, over, 2,800 drugs or so, maybe a little over 3,000. I don't know the exact count yet. I'm trying to find that out. But I'll tell you this, that unless you're really, really sick with a lot of name brand drugs, just if you got a client that's interested in that flex plan, make sure you bump their drugs they're currently taking up against that flex plan formulary. And if it fits, man, I'd write it all day. I'd write, family members on it. So it's an awesome option, especially to help save some money for those olders that may not be able to get through underwriting. Our PDPs, Tana, did you want me to take this one too?
Yeah, sure. Go ahead.
Yeah, so we got a couple out there. We all know we kind of got a middle of the road one too. Doesn't pay commissions, but this, this Medicare choice, the one on the left in the blue there, $16.40, guys. I will tell you, we pay commissions on that. Most of my competitors do not on their lowest premium priced PDP plan. And we sold these like hotcakes, man. That's kind of crazy saying, right? But we sold a ton this past open enrollment, this Choice RX, so it's a great plan. And then our value plan, is quite steep, but that's our largest formulary that we have. I think there's over 3,600 drugs on it. And, as opposed to that Choice plan down at the bottom, you'll see those preferred pharmacies, as Tana mentioned earlier, H-E-B and Walgreens. When you jump on that value plan, it really opens up not just a formulary, but it also opens up some additional preferred pharmacies for you there with Albertsons, Brookshire's, H-E-B, Kroger, Walgreens, Walmart, and a lot of mom and pop independents and pharmacy out there. Med Sups, as you know, we've had I've talked to clients and the agents that talk to clients that say, I know Blue Cross may be a little more on their premium, but I've had Blue Cross Blue Shield my entire career and as an employer plan, and I want Blue Cross. I'll tell you this, it's pretty steady. When you look at our average increase, decrease over an 8-10 year period, it's pretty steady somewhere around I think it's currently about 3.5% averaged out. So that's pretty stout. I've been in the business long enough to see some of these carriers jump 21% in a single year for a block of business. So, our Med Sups, we write, our agents write a ton of it. There's multiple discounts awarded for our members, whether it's tobacco discount or household or Continue with Blue. Or Continue Blue, if they've been on a group plan, it's 7% should they continue with a Blue plan. In the past, prior to 1/1/23, our household discount was also 7%. So January 1st of 2023, that household discount jumped from 7% to a 10% household discount for anyone that was written on that med sup with us a 1/1/2020 and after. So, if you got clients on that you've written on a sup that's got a household qualification, that should have automatically happened January 1st of 2023. Shouldn't be anything you have to do. I ran across one recently, and I haven't had a chance to sort through it yet, that the agent caught saying, hey man, I'm looking at this and it doesn't look like it's jumped to the 10%. And so I found out through escalation this morning, as a matter of fact, that when that happens, all you need to do is have that client reach out to member services and say, hey, I'm supposed to be jumping to that 10%, and it still shows me it's 7%, and they'll handle it. So, it's a great plan option, and we're happy to bump that up to a 10%.
Yeah, so I think you already kind of covered that one, Alvin, on the 10%.
Yeah, and one guy I want to point out on this slide, guys, this Blue 365, right? I mean, we got the routine eye exams, the true hearing discounts. This Blue 365, all you've got to do is get on your computer and Google it, even if you don't do it through Blue Cross Blue Shield site. And what you will find, guys, and this really surprised me, I'm not talking just about a few discounts. I'm talking about tennis shoes from Reeboks to Skechers to, tons of workout equipment to diapers to baby wipes to, and so any person that is on a Blue Cross Blue Shield of Texas plan, whether that's a group plan, whether that's an individual product, or whether that's a Medicare product of either product line, every one of those people have access to set up an account on our website, I believe 365. It's a dashboard, and when they get in there, they can see all the tons of product offerings there are for discounted items. So, when you think about a week for a family, or in what we get exposed to and need and have to purchase, we can really start adding up, snowballing those savings if we just be smart and try to utilize some of those added additional offerings that's free. Doesn't cost them a dime for that Blue 365. So
Perfect. Thank you, Alvin. So since I'm kind of learning, Alvin, like he mentioned, he is familiar with MedSups. He likes it. So I'm still learning about the MedSup world. But one of the things that was not on the slides, Alvin, and correct me if I'm wrong, is that for the agents, we pay full commissions on guaranteed issue. Is that correct?
Yeah, even though we pay a little bit lower than some of our competitors, that is correct. Most of my competitors are going to only pay you maybe 25% of that commission, whatever it is, for a guaranteed issue. Blue Cross is the only carrier that I'm aware of, and has been for the longest, that will pay you 100% of whatever that commission level is, even if it's a guaranteed issue app. Great point, Tana.
Okay, perfect. Just wanted to make sure I wasn't confused. So another thing, so we offer a lot of marketing samples. You can go into the portal, customize a lot of your own. If you want email templates, direct mail, that kind of thing, there's a lot of great options out there for you to use. And then we also have our portals. So if there's any of you guys that are joining us today that need more information about how to access the portal, what you can find out there, please reach out to Alvin or myself. We're more than happy to help you on that. The retail producer portal, that's going to be where you can find your book of business, look up the status of enrollments. Then you have the supply portal where you can access all those marketing materials, and then also order your AEP materials through there. And then GetBlue's TX is one of my favorites, only because you don't have to have a login. So I'm all about any kind of website. You don't have to remember your darn password or double authentication. So I'm all about that. On the GetBlue TX website, you can go look up for documents, evidence of coverage, ANOC events, forms. You can look up provider networks, that dental network that I talked about earlier for dnoa.com. you can find that there. There's a lot of resources that you can find out there as well. So if you're not familiar with the portals and you want to get some more information on how to access that and what all you can find there, just please let us know, and we're happy to help. Anything else that Alvin and I can do, we're always happy to help. We didn't really talk a lot really about ourselves. So I'm in the Medicare space previously for 10 years at a regional health plan here in the Dallas-Fort Worth area. I joined Blue Cross Blue Shield October 3rd. Horrible time to start a new sales job with a carrier right before AEP, but super excited to be part of Blue Cross Blue Shield and the brand that it offers. So mainly Alvin and I split the DFW area by county. Pretty much it's 35E West would be my area, all the way up to Wichita Falls, out to Weatherford, Mineral Wells, down to Stephenville, Granbury, that territory. And Alvin is pretty much northeast all the way to Louisiana and Arkansas border. And then Alvin lives down in the Waxahachie area. I live North Fort Worth and Haslett area. So anything we can do to help you, educate you on Blue. I think we're working hard on enhancing some stuff for 2024 to make us even an easier product for you to sell going forward. People that I've talked to that have written Blue in the past definitely said we're going in the right direction. Our benefits are better than they ever were before. Our network is better than they've seen in the past. So we are really working hard on making things better and being the plan that you guys want to sell. Alvin, anything else that you want to add to that?
No, Tana, I think you covered it, guys. And just know, you know, we the last announcement I have is be looking for what we've got rolling out in 24. Beginning the middle of July, we're going to be doing some sneak peek events all across the state. There's 8 of us now, regional sales managers scattered out. So Tana and I are trying to work those in tandem. So, you know, be looking for those sneak peeks that we'll be having. And then probably the first part of September, we'll be back out and about doing some product rollout meetings, you know, being able to take those deeper dives. And so even though we're going to be doing a lot of those face-to-face of both events, we're going to be doing twice as many virtual events. So if you can't come see us at one of our stops that we'll be publishing pretty quick, try to tune in on what's to come for 24 through one of those virtuals. But thank you for your time.
Awesome. Thank you, folks. And thank you, Elvin, for mentioning the fact that you guys have a presence throughout the state, so you have counterparts in other markets that can help people that are a bit of a, pardon the expression, carpetbagger, working multiple markets. So we really appreciate that. And I think folks will see today's presentation illustrates why we partner with Blue Cross Blue Shield of Texas, in the fact that they have a full portfolio and they do not abandon one of their strengths, which was their Medicare Supplement programs that Alvin mentioned, pays a commission on different products different than just about everyone else in our neck of the woods. So we want to make certain that folks realize that that's there. One of the things I want to emphasize as well is the fact that the folks that are visiting with you today have experience in our industry and have run across a whole bunch of the questions that you see quite frequently in the field and are a great resource for you. We've got some questions here that are basically coverage questions about the product that you did cover. So John will make certain that, yes, you do receive the PowerPoints that we are utilizing today as part of the follow-up to today's presentation. I want to close with a few quick points as to why you would want to do this business with Blue Cross Blue Shield in Texas with Premier. And that is the fact that we work to get you contracted as quickly as possible, do some things electronically there. Blue Cross Blue Shield does some things different than a lot of our other carriers, and we want to make certain that we accommodate what you need to get up and going. But creating an agent profile in this software package allows you to contract with multiple organizations, including the ones that layer on to the coverages that are discussed today. So those ancillary products to address the specific needs of your prospects and clients. Let's face it, the world's gone electronic. When I started in the Medicare Plus Choice programs last century, we didn't have hammers and chisels, but we weren't far from that. The electronic process is incredible, and it's something that we all have to realize is part of the new normal, and that's the way it is. We actually have some carriers that don't do paper at all, so some things to consider there. We do offer discounted E&O to qualified agents. Errors and admissions for what makes me a qualified agent? Well, you got a contract with us, but this is a program that you own and takes care of the requirement that you have with insurance companies in order to contract. Premier is a huge organization. We have a very robust portfolio, but we're not everywhere with everything, and we realize that. So there are organizations that you're going to look to contract through for certain products that perhaps we don't offer, and this is a requirement that is covered through this discounted errors and admissions coverage. We do also offer discounted continuing education programs through our association with WebCE to keep your license in play. And as an agent responsible for their own benefit package, you do have an opportunity to take advantage of a modified guarantee issue disability income program on yourself, on which you are paid a commission. I mentioned that today's presentation is being recorded and it will be posted to our websites. And you'll see here that it's on our website and it's on our YouTube channel. But this gives you the opportunity to take the programs that Blue Cross Blue Shield offers and positively market them. So we have campaigns that help you be effective with centers of influence in the community, different ways of making certain that the programs that you have contracted for are an egg you are going to hatch. You can write business with them, and a lot of that is helpful with these previous recordings that we have in play. This is a tool that we offer all of our contracted agents, and it is the Medicare Center program, which gives you access to multiple quoting engines, 3 precisely at this time, where you have the programs that are powered by Connecture, Sunfire, and CSG. And when you look at the product portfolio that Blue Cross Blue Shield offers, you're going to make use of each of these programs in there to make certain that you can deliver the information we spoke of much earlier in the presentation in a manner in which the folks hope to receive it, but also keep you compliant. So this gives you the opportunity to collect that scope of appointment and record those calls and keep all of that information for that 10-year period, whether you sell that person or not. That then gives you the opportunity to make side-by-side plan comparisons and take advantage of a program that doesn't cost you to store all that information. It also gives you an opportunity to make use of a complimentary PURL, a personal URL that is your microsite that you dictate what programs are available for the public to see on the World Wide Web. And when people, as I mentioned earlier, shop, you can direct them to that site for your information. They can actually enroll through it, and that's your client. We want to make certain that you have that presence out there, and we realize that as folks are aging into Medicare now, they're much more adept at finding information and shopping beforehand. The program also gives you a CRM, a contact management system, that enables you to look at the offerings that you have year over year with prospects and clients. And that then gives you the opportunity, as you enroll someone in a Blue Cross Blue Shield MA plan or PDP program, how you can do an annual review very easily and make certain that you realize that certain folks within your database may be subject to or more likely to change. And that's where you'll see some of these switcher tags come into play. They help identify folks that may be vulnerable, and it gives you the opportunity then to manage your calls to make certain that they are taken care of. We'll talk about Lead Center in just a minute, but one of the things that we have as agents is not only the opportunity to create leads, but also to close as many of those as possible. If we think about it, and we can increase our close ratio, we don't need it. This system, with the resources that are within it, helps you hone your sales abilities as well and gives you that opportunity to bump up your close ratio. This program is available as a mobile application and to paraphrase one of those quasi celebrities that Tana mentioned earlier on the TV commercials, it's free. And I never liked him when he was on that TV show, but hey, whatever. Commercials aren't much better. It's a great way for you to have cutting edge technology without cost through a contract with our organization. It gives you then that opportunity to use tools to not only sell your base products, but cross sell as well. Many programs do offer additional incentives in the Medicare Advantage and PDP space. Well, the max comp set by the government, so that's not the circumstance there, but MedSups frequently do. The ancillary programs, you do life insurance, some of the other things, there may be additional incentives to make certain that you are getting full compensation for your efforts. That may qualify you for carrier trips and will qualify you for premier incentive programs in many circumstances that include the return of the producers convention that has been on hiatus with the rise of the pandemic over the last couple, 3 years. We also want to make certain that you realize we're going to do some things to put you in front of folks. So if you are a cold caller, good luck with that. I've taken 6 this morning, and 4 people, if you heard that phone ringing in the background, I apologize. That was probably me. And those are folks that are dialing, smiling and dialing. Some folks still do it, and you can do it for MedSup. Can't do it for MA or PDP, but it's a great way to make use of some of the tools, including that CSG thing that offer a complimentary Medicare supplement review. And as we'll discuss next week in a webinar on Medicare supplements, how that is not based just on premium. Alvin alluded to the fact that year-over-year price increases with one of the premier name products in the market is minimal, and that's one of the things we discuss next week as well. We want to make certain too that you are able to use the programs and the marketing support that Tana mentioned to positively influence the community that is your target market. And that includes working year-round in retail marketing organization opportunities. So if you worked a Walmart or a carrier-based retail program, that opportunity did not end on Pearl Harbor Day. That is something that you can maintain month after month with the proper approach. And we go through and discuss that in some of our trainings. The same circumstances there for you in order to take some of the programs that have been mentioned today and present them to faith-based organizations, because you'll have people that will respond to that sort of outreach that aren't responding to different marketing opportunities, and it ingratiates yourself into those centers of influence in the community. We also have provider marketing programs that help you with the doctors and other delivery of care individuals. And it's important for them to note that you are not a one-trick pony, that you're not out there just for one product. You have carriers like that they recognize, have great working relationships with, that have a full portfolio, so we can speak to them about maintaining the payer mix that they desire for their practice. Certain carriers do generate prospects for us as well. That is generally in the Medicare Advantage or PDP space, but that's a quid pro quo situation. I had to throw a little Latin in there. You scratch my back, I'll scratch yours. When you work with an organization like Blue Cross Blue Shield and you demonstrate that you are marketing their product and producing for them, you may have the opportunity for additional opportunities there as well. We'll talk a little bit about our social media leads in a minute, the direct mail support, elaborate on Lead Center, T65, and a referral program. That mail support is based on production, and depending upon what you're marketing, you can qualify for 2 different programs, one for health programs and one for final expense. So MedSups will count here. Generally, the MA or PDP do not, simply because of compliance regulations, but this gives you the opportunity to drive down the cost of direct mail, which, by the way, had an increase here very recently, and this program did not see an increase in your share of that cost. It gives you the opportunity to do things consistently. So direct mail, to quote Mark Twain, paraphrase him anyway, the reports of its death is greatly exaggerated. If you do things consistently with direct mail, that's where you're going to see the results. It's like an exercise program. You do it once, you feel a little bit of the pain, you might feel a little better about yourself, but you don't see a lot of results. If you do it consistently, that's where you're going to see consistent lead flow as well. That does require a commitment on your part for the dollars that go into it, but they're an investment in the opportunity to visit with folks in the near future. We work through preferred lead vendors where these folks are vetted to make certain that they have systems to deliver those leads to you as promptly as possible and make certain that the correspondence that goes out is compliant. We're looking to keep ourselves all safe from any sort of challenges we may have when it comes to compliance and the information that we're using in our outreach. We do also have access to never distributed direct mail responses, and these are through one of our partners that give you an opportunity to fill in holes in your schedule. Prices will vary from time to time and from market to market, but it is a great way to fill in your calendar and make certain that you have a full schedule of folks with whom to visit. The first of the internet lead programs we have is faith-based, pardon me, tell me what's on my mind at the time, Facebook leads. And there are programs for both final expense and Medicare. What we want to make certain that we do, however, is remind you that these are very microwave type of leads. They respond very quickly, but they expect you to respond very quickly as well. I have a friend who you got a lead in at 2 o'clock in the morning. She contacted them at 6 in the morning, and they are already gone someplace else. So we want to make certain that we microwave folks back as well, and that includes the use of a new partner that we have that makes use of search optimization techniques to get folks interested in the products that you offer as well. Your marketer with Premier will help you with the cost of those programs in specific markets. Lead Center, this is part of that Medicare Center program, but it is a program within that technology that allows you to turn on and off leads that you purchase, in many cases at a deeply discounted rate, but you can have a hot transfer, or you can have the information put into your CRM and work it that way. It gives you the opportunity to control lead flow through a system you're already using that incorporates in that contact management system. A great way for you to fill your calendar, fill your leads that are actually turned into clients, and of course, fill your bank account because you're selling something. When we look at the T65 locator, this is another piece that's available to you without cost as an agent within our organization. Boy, you can tell I'm an old MA agent. Without cost. I have a hard time with that JJ Walker word of it's free. But you download this to your smart device, you register, they find that you are contracted with us for a program. It gives you then access to a system that is going to lay out basically where folks are based on the parameters that you have. And Alvin and Tana, I'm going to do this really quickly. There we go. Sorry. I cut off your webcam. Sorry. But this gives you the opportunity that if you're stacking appointments in a particular market, one cancels, what do? Well, you can hit the centers of influence in that area. But if it's a deeply residential district, maybe you're not so much. You can use this perhaps to identify 64-year-olds and door knock for dental programs or final expense or another program that allows you that type of marketing activity. And pardon me, I got a question that popped. Thank you. It was more of a thank you, I'm on my way. We also want to discuss that referral program. And what this does is it gives us the opportunity to work in the system that gives you well, we're going to take one lead, throw it on the water, so to speak, and it'll come back in multiple force. This is going to give us the opportunity to visit with folks in our sales process, be they prospects or clients, and help make one lead multiple. But it also gives you the opportunity to continue to engage your book of business by going back to those folks and say, hey, an innocuous campaign is, I got a dental program that's really popular in your area. I want to ask if you have folks that are in need of dental services. A lot of them will say, well, what about me? There you go. You've engaged your book. You've created a referral opportunity, and it's a great way for you to have very cost-effective leads through simply remembering you don't get kissed if you don't ask. So that sort of program comes into play. We do this because we want your business. We want to be part of the systems that you use to make yourself and your agency successful. And what you have seen today is an opportunity to add one of the premier name carriers, no pun intended, premier, to your portfolio if you don't already have it in play. But if you've got the contract, it gives you an opportunity there as well to utilize some of these tools that you may not have been utilizing before. The portals that Tana mentioned, they are part of a system that when agents statistically have been shown, if they are accessing that sort of marketing material and making use of those tools, they are a much higher producer across the board and specifically with that carrier. We want to make certain that this becomes part of your marketing plan and you have an opportunity to put it in play as quickly as possible. At this point in time, I want to check and make certain that we have questions covered. Yep, we've got them covered. So at this point in time, for those of you that have been viewing this presentation and have worked with Premier in the past, I want to thank you for the business. We hope that through programs such as Blue Cross Blue Shield of Texas, we're able to enrich and deepen that relationship as well. For those of you that are just checking us out, thank you for the opportunity. We look forward to visiting with you about the multitude of programs that we have available, but specifically the opportunity you have with Blue Cross Blue Shield in Texas, and specifically at this time, the North Texas market. And most importantly, because we have taken an hour of your time today, I want to thank you for that investment of your time. We realize that is your most precious asset, and we thank you for spending some of that capital, in a manner of speaking, with us here today. So that said, checking questions one more time. Nope, we're good. I want to thank you for coming on with us once again. And until we are able to visit in the very near future, I wish you good selling. Anna and Elvin, I thank you for your help today. Look forward to the presentation and we can share it with the agents across the board.
Thank you so much.
Thanks, Dana. And thank you all for coming aboard. We'll speak to you soon.